Hello! Today, I know you're super excited because we're continuing our talks about urinary infections. Today's talk is going to focus mostly on females because we're going to talk about recurrent UTIs and strategies on how to prevent those. As previously discussed, urinary infections aren't as common in men because the distance from the bladder to the outside world is further for them. So, men, still pay attention because the women in your life want your support. But we're going to focus more on non-pregnant women today. We're talking about people who have had 2 or more urinary tract infections in the last 6 months or 3 or more in the past year. You want to make sure and actually confirm the diagnosis at your doctor's office because a lot of times we'll have discomfort or irritation of the bladder and it may not actually be infected. If you're a little bit dehydrated, the urine becomes more concentrated and can be uncomfortable that way, make you feel like you need to go more often or hurt a little bit either during or immediately after your void, as we like to call it. There are a couple of other things that may masquerade as an infection. One is difficult to say, it is interstitial cystitis, which is sterile urine, meaning not infected, but there can be white blood cells in the urine. So that is completely different and needs to probably be addressed either by your primary care doctor or perhaps gynecologist or urologist. Others are, as said before, dehydration or everybody's other favorite problem, constipation. Thankfully, most of the time these recurrent urinary infections are moderately easy to treat because the person who's had them is pretty familiar with how they feel, and so they get in to talk to us early so that we can get therapy initiated rapidly and avoid long-term problems. Generally, we don't have to do any extensive workup like CAT scans or ultrasounds. We kind of know what to look for in these women. Risk factors include having a mother who had recurrent UTIs, spermicide use, new sexual partner, frequent intercourse, menopause, and cystocele, which is a defect in part of the pelvic floor that distorts the architecture and makes it more likely that your bladder doesn't drain appropriately. Generally, we don't have to do any extensive workup like CAT scans or ultrasounds. We kind of know what to look for in these women. Risk factors include having a mother who had recurrent UTIs, spermicide use, new sexual partner, frequent intercourse, menopause, and cystocele, which is a defect in part of the pelvic floor that distorts the architecture and makes it more likely that your bladder doesn't drain appropriately. If you happen to get recurrent infections with a bacteria called Proteus, that actually is strongly related to kidney stones, and you may need further workup if that's the case. Strategies to help prevent. We really try to avoid antibiotics if possible to keep these from recurring. So we'll talk about first antibiotic sparing strategies. Some of those are, 1, make sure you're not constipated. What I like to say is make sure you're a super pooper, which might mean a daily stool softener, eating more fiber, drinking more water, etc. We'll talk about constipation in another video. Urologists recommend liberal fluid intake, meaning 2 to 3 liters of water a day. Acidic beverages and caffeine can both cause irritation of the bladder and that feeling that we discussed earlier. For women who are menopausal, topical estrogen therapy can be very helpful too, as long as you're not at increased risk from that. Another strategy is voiding or going to the restroom immediately after intercourse to help any bacteria that may have built up. When all else fails, you may need antibiotics. Some people just have them for post-coital use, meaning 1 dose after intercourse to help keep the bacteria at bay. In the more severe cases, there are people who take continuous daily antibiotics. We really try to avoid that if possible because of the issues we have with antibiotic resistance, and we're not trying to breed superbugs. So hopefully between you and your doctor, you can come up with strategies to help keep these at bay. Don't forget, drink 2 to 3 liters of water a day. Don't forget to like and subscribe, and stay tuned for more.